Welcome to the Failure is Always an Option podcast. I'm your host, Adam Scroggin, and today we have a very special guest, Jaime Bristow. Jaime is both a CEO of a tech company called Lift Health and a psychiatric nurse practitioner. How you doing today, Jaime?
Hi, Adam.
So how was your day? What did you work on today?
So, I'm a practicing clinician, so I was seeing clients today as well as working on Lift Health.
Why don't you tell our audience a little bit about what Lift Health does and what you do for Lift Health?
So, Lift Health is a digital health company. It's something that I started not too long ago because of increased need for platforms and ways of helping people in the mental health system, something that I've always been passionate about. And I actually met my current CTO about a year ago, who is Adam Scroggin.
Me, of course, yes. I am also the CTO of Lift Health. I've been working on the engineering of our first project, the software engineering, that is.
Right. But it really comes out of the acute need for people in the mental health community. As we know, even since COVID, but before COVID, we've had a huge need for mental health care in this country and in the world. And I saw something that could be fixed in the system, and that's what inspired Lift Health and our first project.
It's really interesting. So COVID had a huge impact on a lot of people. How did you see the need for mental health change, or did it even change during COVID?
Oh, it did dramatically. So during that time, I was working for a community mental health center. And for those of you who don't know what a community mental health center is, they're what we call the kind of the catch-all in communities. So typically in larger cities, they become more sparse throughout rural areas, but they're typically government-funded or state-funded agencies that help people in the community with mental health issues, whether that be medication management, therapy, substance abuse services, and things of that nature.
Wow. So you've seen some stuff. How long have you been a psychiatric nurse practitioner?
So I've been a psychiatric nurse practitioner for 5 years, but I've been working in psychiatry for about 15.
Wow. It's really an amazing field. I myself, as a software engineer, I don't know a lot about it, but I've learned a ton for you, and it's been an absolute pleasure working for you. I've learned so much. So your first project is a platform called Mind Scout. Can you tell our audience a little bit about Mind Scout?
Right. So Mind Scout, it's one of the solutions I kind of mentioned before. It is a platform, a digital health platform, and it's intended to be a SaaS, or if you could explain SaaS.
Software as a service, very similar to subscriptions that you have every month, like Netflix, Disney Plus, HBO Max, etc.
Correct. But it's meant to be a service for both healthcare professionals at any level. That includes primary care to mental health clinicians, therapists, and anyone that might come into contact with a person that has a mental health need. But it's also meant to contact patients. Basically, when I say patients, I mean just people out in the community that think that they might have a mental health need. And Mind Scout is the platform that we've designed, from some of my inspiration and ideas working in community mental health to help with assessing and diagnosing people appropriately and helping with this huge bottleneck issue that we have in our mental health care system.
Right. And so you're doing both a portal and a mobile app. Can you tell our audience a little bit more about the mobile app?
Absolutely. So our mobile app is going to be designed to have both a healthcare professional facing side as well as a patient facing side. And they're going to have slightly different functionalities. So the healthcare professional side is going to have the opportunity to, for those people that come into contact with someone that has a mental health care need, they're going to send this link to their patient, and it's going to take them through all of the foundational assessments needed to get a broad spectrum, the basic foundations of mental health care assessment. And then it will send that information from the assessment back to the healthcare provider.
Right. And so you just recently did some mock-ups with the designer and are getting ready to do some testing with paper prototypes. Why don't you tell our audience a little bit about how you went about with your team building these paper prototypes for testing users or patients.
Right. So actually, it was a lot of fun. I love looking up at research and design. I actually was a scientist in my previous life. I worked in science, a benchside scientist basically. But this has really kind of invigorated some of my research and study design things from years past. But the process of building an app is something that I've had to learn. I've had some help and coaching from yourself, but also going to a lot of different tech and networking events and doing a lot of searching myself, through a lot of other resources. But it started off with me knowing what needed to be done, because I'm very familiar with assessment and diagnosis. Choosing the assessments that I wanted to use that are all evidence-based, well-studied, and well understood by healthcare professionals. And then doing something called wireframing, which was actually a lot of fun. We used a platform in order for me to start designing what each screenshot would look like and how it would flow from screenshot to screenshot, depending on the part of the assessment and what the functionality is going to be. And then the next part of that is to try to do some paper prototyping. So actually taking those screenshots, printing them on paper so that somebody can hold them in their hands and see if they're able to get basically that sort of real life feel, in a sense, without the digitizing part, to see if that is working as intended, so that we don't start building and putting lots and lots of man hours into something, knowing that, oh my gosh, yes, we've already found some problems that we need to go back and fix.
Right, and this is not my first rodeo when it comes to paper prototypes. I've probably done it 5 to 10 times, I'm not sure. And you're absolutely right. We as engineers and developers, we can crank out code, but sometimes we are not building the right thing. And this is why we invest a lot of time and the money into the research and actually testing with real users to make sure that we're building something that's going to meet their needs and is going to provide value, that it actually can be used. Writing code for us software engineers and developers is relatively the easy part. I don't want to trivialize it too much, but we don't want to crank out a bunch of code and spend $1 million and find out that we're not meeting the end user's needs.
Right. And even though it's easy, it is a very time-consuming process.
Right. Working with designers, doing some user testing, it does take time. What are some of the challenges that you've faced so far as you've added to your plate, not just only being a psychiatric nurse practitioner, but also being a tech CEO?
Well, as I mentioned before, I was in scientist, so I've always been in tech to some degree, just not in this area, and I'm certainly not an expert in it. So one thing that I've learned through my first career as a scientist and now in my second career is you have to use your resources and you have to really get a sense of where your strengths are and weaknesses too. And of course, there's everything in between. And working on the things that I know that I can learn, but also using those other experts. It's so important. Of course, when you're a new startup, just like we are with Lyft Health, you have to be mindful of things like financial resources and time resources and figure out what the balance is, what you can put out yourself, and really, where you might need to, use the finances that you have in order to make some more progress. So, learning that balance along the way. And of course, I love learning. So this is a bunch of stuff I get to learn too. And I love listening to other people who are in tech and learning about things that I've never heard about before. It's such a great way to synthesize, new knowledge, get to know about new things, new products, and ways of doing things.
That's very cool. And for our audience, what are you reading, studying, podcast? What are some of the resources that you're using right now that you could tell our audience?
Well, I'm also in an integrative psychiatry fellowship that I'm getting ready to wrap up. So it sounds like I'm probably doing a lot. And for those that know me, that's kind of what I do. I do too many things, and then I might do a few less things for a while, and then I do too many things. But I think it's really just because I have a zeal for learning and creativity. So finishing up my integrative psychiatry fellowship, but I like exposing myself to different ways of thinking about things and doing things. Some of the podcasts that I've been listening to lately, are still related to psychiatry and neuroscience, One is called the Neuroscience of Faith podcast. Another one is the Carlott Report, which is a lot about psychiatry and medication management, but also different kinds of therapies. But another podcast that I was introduced to is called the Happier podcast. And these people,
Cool name.
they're not psychologists, they're not psychiatrists or anything, but again, they have their own kind of way of going about things, and I've certainly learned some things from them. And then I also love Crime Junkie, which is a local podcast, if anybody here is familiar with that.
And what do you
So-
mean by local, though? Why don't you tell the audience where we're at here?
So we're located in central Indiana, and the Crime Junkies podcast is also from Indiana as well.
Very cool. So just recently, there was some news that you were elected president of the Indiana Association for Child and Adult Psychiatric Nursing. Why don't you tell our audience a little bit about that group and your role in that group?
Sure. So I know that's a mouthful. We usually just call it ICAPN.
Okay.
So this is actually a group that has been meeting for a long time. It came out of another group of advanced practice nurses from CAPNY years and years ago, and it's a local Indiana-based group, and basically the function of it is to mentor other nurses, not just advanced practice, but other nurses in psychiatry, mentor, to network, to share resources, and also to continue to learn from each other. And we get speakers. I actually gave a speech, or I should say a lecture, not too long ago about evidence-based assessment and integrating new technologies. But it's a way that we can continue to kind of keep in touch with each other. We also look at local legislative action, and I've been serving as vice president for the last 3 years, and I was just voted in as president.
Well, congratulations, Jamie. That's really awesome. So in the field of mental health and psychiatry and nursing, I myself have, I've gone to therapy, and, I've been to the hospital. I've taken family members to the hospital. I have to say, nurses rock.
Yes, we do.
Yes, you guys go through a lot. You deal with some very squirrely situations. As a nurse, psychiatric nurse practitioner, what puts a smile on your face at the end of the day?
Every time, any time that I feel or get, feedback from anyone that I have partnered with them to make a difference in their life. I take very, very seriously, every interaction I have with clients. When they are feeling better, when something in their life has improved, that is always what puts a smile on my face. And that's professionally as well as personally. I do deal with a lot of very difficult situations, a lot of people in crisis, a lot of people that can't explain why they feel the way they do. And going through those journeys with them is all very, very special, and it's very precious and serious to me.
Right.
And it's one of the things that gives me a lot more capacity to keep going, and again, to even create something like, I am with Mind Scout and Lift Health, because I know that there's better ways of doing things, things that, again, we should already be doing, and a lot of people, when they enter the mental health care system, assume are being done, and they would unfortunately be wrong a majority of the time. So that's why I'm like, hey, we need to work smarter, not harder, because there's a lot other harder stuff to deal with.
Right.
When you're dealing with the mental health care system.
And has how has tech either helped your job or even hindered your job? We have Zoom now, or telemedicine, telehealth. Has that made things better, worse, indifferent?
I think it depends on whom you ask. Again, going to strengths, weaknesses, and everything between. For me personally, being able to do telepsychiatry, which is much more specific to my area, has really been a benefit.
Okay.
Because I can reach a lot more people. And with the current company that I'm a clinician for now, I can reach people all over the state. If people are traveling or on vacation, or just happen to be like, hey, gosh, I didn't realize I had to go to this place or that place, I can still actually meet with them, and I can still serve them in telepsychiatry. So it's made it much more expanded, more accessible, and there's certainly challenges with that. There's certainly something to be said about meeting with people face to face, and there's always going to be that important aspect because that's something that really involves some real behavioral change and connection with humans, which is something that we need when we're working on mental health.
Totally agree.
But this expands the access, and fortunately, I wouldn't, again, working in tech would not say that I am the best at all of the technologies that I use, but I'm very teachable, and I also want to learn so that I can do better for my clients. So I'm often somebody that people may call or Slack when they're having issues with whatever platform they're using at work. And even if I don't know it, I'm one of those people that I'll be like, hold on one second while I figure out the answer.
Wow. It's very cool. So for our audience out there, I think that's one thing that's really cool. We need more women in tech. You guys, there are a lot of underrepresented groups in tech, and women and other minorities are one of them.
Absolutely.
What would you tell our audience, the women out there, or even other people in minority groups who want to become, an entrepreneur or a leader in a tech company?
Well, again, so I'm a CEO of a tech company now, but I've always been in tech. And as a woman working in science, I faced a lot of very similar obstacles. And a lot of times those obstacles are with personalities and companies and systems.
Right.
And that's something that we have to learn to navigate with our strengths. And also, be reasonable. And, again, recognize if if you're in a place and you're feeling like it is not a place where you're able to do and accomplish the things you want, it may not be you. There's so many toxic work environments now.
Right.
And that's something that some places recognize and a lot of places do not.
Right.
They tend to put the blame on the person or individual that they can't, accommodate to this toxic system. But again, it takes some work to realize when you're in a toxic system versus, hey, maybe there are some things that I need to do differently. So really, don't give up. It's always something that's important to do. And this is something that we talk about, in nursing a lot, is take that time for reflection.
Right.
And, go to other people and get their opinions. Even working in psychiatry, I avoid advice because you don't know everything about everything enough to give someone the answer, all right. Even in psychiatry. So, again, gathering up information, reflecting, but certainly if it's something that you're passionate about, that passion can drive you. It can drive you past a lot of obstacles. And those obstacles, they can be there for a really long time. And you need to have something to help you, and you need to have a support system to help you through those hard times because, again, it can last a long time. For some people, it's a short time. But again, you have to keep going, and you might need to maneuver around several kinds of personalities in your life.
Yeah, and I can relate to that too. And dealing with people, politics, big corporations, it can be a challenge. And, everyone out there, try to keep an open mind. Doesn't matter if it's a woman or a person of color, even men, even men can face, sexual discrimination or just a lot of preconceived notions about people.
Absolutely.
So yeah, I would say, like as myself, I just look at people as people and about what they do and not necessarily what they look like.
Absolutely. The individual is key. In my line of work and even in my experience before, we tend to, as humans, we stereotype, and that has a negative connotation, but it's there because it helps us to make quick decisions and judgments about the current time and now and things of that nature. So, I don't like to demonize it either.
Right.
But again, like you said, you have to keep that open mind. I always like to tell my clients, there's always a ... at the end of our conversations because you'll never know everything because we see the world through our own filters.
Right.
And that cannot be removed.
Right.
And whoever you're interacting with, they also have their own filter. And those change and evolve over time. It's a little bit more up to us how we change our filter. So, we can work on that and change it for the better and maneuver through our lives that way. And we can't expect others to change their filter at the same rate that we do.
Yeah, that makes perfect sense. I know a lot of us sometimes we look at the people we work with and we want them to change, and sometimes you can provide feedback and help them
Right.
and get better.
Mhm.
But you always have to look at yourself and introspect and look at yourself and maybe think, what am I doing? Am I doing something wrong?
Right.
How can I improve? We are who we are through all the experiences that we've gained through
Mhm.
life. But we can all be better, be kinder, try to work with each other better.
Absolutely.
Yep.
Absolutely.
So, outside of work and all the things that you're doing, which I know you're doing a ton, what do you like to do?
Oh, lots of things. Again, always have lots on my plate. So, some of the things that I really enjoy include activities like crafts. I love to be creative. I like sewing. I actually started sewing clothes again. Something that I
Cool.
did when I was growing up. Yes, of course, the clothes that I make now are a little bit different than back then, but it's a creative outlet, and it's a mental challenge. That's another thing about keeping our brains healthy is always doing new things and new challenges, even if it's just slight variations. So that's a
Right.
great thing to keep yourself sharp. Um, Painting, I love painting, all different kinds of crafts, jewelry making. I also love, nature. I have a garden. I have backyard chickens.
So cool.
Yes, I get wonderful eggs, and now I'm an egg snob.
Eh,
Um, and I love hiking, camping. I just love being active. I do work out most days of the week. I get up in the morning, and that's how I start my day, is by getting in some physical activity.
right. You do CrossFit or something, right?
Yeah, I have not been able to do CrossFit as much. I actually hurt my back about a year ago not doing CrossFit. So
Okay.
all of you people that are nodding your head, the CrossFit, it wasn't doing CrossFit. It was digging a new garden bed.
Oh, jeez.
So, so I've been, pulling back and taking it more recovery. Again, working on my weaknesses at this time, making sure that my foundation is solid. Again, a lot of times we look at these things like failures, and they do, and I always tell people, hey, I honor when you feel that way. I have to honor when I feel that way myself. But again, it's always an opportunity. It's an opportunity to work on your foundations, your basics, to help yourself come back better or stronger.
Right. And so I got to see your gym. What is it called? The Broad Ripple Fit Club?
Yes. Mm-hmm.
It's very cool. I highly recommend it if you're in the Broad Ripple area. Go check it out.
Wonderful people. It's a great group. It's a great community.
I agree. The people there are so kind and so nice and open to talking. A lot of smart people there too.
Absolutely.
And what if our audience today wants to learn more about you or your company? How can they find you out on the web?
Oh, absolutely. So they can find me on lft-health.co. And of course, I have a LinkedIn profile, so they can find me at Jaime Bristow on LinkedIn. And my first name is spelled a little special, so I'll spell it for the audience. It's Jaime Bristow. So you can find me on LinkedIn as well.
All right. So I got to talk to maybe one of the coolest people in Indiana that I've ever met today. So thank you for your time, Jaime. Have a great day. And follow up, listen to our other podcast, and we'll see you on the next episode.
Thank you so much.